Hi, I'm Dr. Jonathan. Welcome back. Today we're talking about canine parvovirus, or parvo, what to watch for, how it's diagnosed, what actually helps at home and what doesn't, and how you can protect your dog. If you own a puppy or unvaccinated dog, this video could save their life. So stay with me and hit subscribe so you don't miss future pet health guides. Is your dog suddenly lethargic or extremely weak? Has your dog stopped eating or shown a big loss of appetite? Is your dog vomiting repeatedly, even mild at first? Does your dog have diarrhea, especially watery or bloody stool? Is your dog dehydrated, dry gums, sunken eyes, reduced skin elasticity? Is your dog feverish or very cold to the touch? Is your dog a puppy, especially 6 to 20 weeks, or unvaccinated? Age and vax status increases risk. Has your dog been in places with unknown dogs or common public areas, shelters, dog parks? Exposure risk. Has your dog shown abdominal pain or a swollen or tender belly? Has your dog had sudden unexplained collapse or very pale gums? Seek emergency care. What causes parvovirus? Canine parvovirus, or CPV, is a highly contagious DNA virus that primarily attacks rapidly dividing cells, most notably the intestinal lining, and in some cases the bone marrow and white blood cells. This leads to severe intestinal damage and immune suppression. The virus is shed in the feces of infected dogs and can survive in the environment for many months. Contaminated soil, kennels, bedding, clothing, shoes, or shared bowls can spread it. Puppies are at highest risk because their immune systems aren't fully developed, and maternal antibodies can wane before vaccines fully protect. Certain breeds, for example, Rottweilers, Dobermans, have been reported in some studies to be more severely affected, but any unvaccinated dog can get parvo. Signs and symptoms. Early, lethargy, decreased appetite, sometimes fever. Soon after, often within 24 to 48 hours, vomiting begins and is followed by severe diarrhea, often watery and sometimes blood-tinged with a very foul smell. This can progress rapidly. Consequences: rapid dehydration, electrolyte imbalance, and secondary bacterial infections due to loss of intestinal barrier and suppressed white blood cells. Untreated, puppies can go into shock and die. How is parvo diagnosed? History plus physical exam. Vet will ask about vaccine status, age, exposure, and examine for dehydration, fever, and abdominal pain. Fecal antigen test, or SNAP test, ELISA. Quick in-clinic test for parvovirus antigen in stool. Commonly used and gives fast results, but can have false negatives early or late in disease. PCR on feces, more sensitive molecular test, detects viral DNA, often used by labs. Blood work, looks for leukopenia, low white blood cells, dehydration markers, electrolyte disturbance, and organ function. These tests guide treatment and prognosis. Imaging, abdominal X-ray or ultrasound, only if complications or to rule out other causes. What about home care and herbal or natural treatments? Important safety note on screen: always consult your veterinarian. Parvo can be fatal. Critical point: parvo is potentially life-threatening. Hospital support, IV fluids, anti-nausea meds, antibiotics, and monitoring greatly improves survival in moderate to severe cases and is the standard of care. Do not rely on home care alone for a sick puppy showing vomiting or diarrhea and dehydration. Supportive home care, only for very mild, early cases, or as directed by a vet, keep the dog warm, encourage small amounts of water or electrolyte solution to prevent dehydration, isolate from other dogs, and seek veterinary follow-up immediately. But again, if vomiting or bloody diarrhea is present, go to the vet. Herbal or alternative remedies. Some articles and small studies or reviews and traditional medicine sources discuss herbs or supplements, for example, certain Chinese herbal formulas or antioxidants that may have adjunctive effects in reducing intestinal injury or oxidative stress. However, evidence is limited, variable in quality, and not a replacement for veterinary supportive care. The use of herbal or homeopathic no-sodes as sole therapy is not supported by robust clinical trials in mainstream veterinary medicine. If owners choose complementary therapies, they must be used alongside veterinary care and after discussing safety and doses with a veterinarian. No specific antiviral drug widely accepted as a proven cure in general practice. Treatment is supportive. IV fluids to correct dehydration and electrolytes, antiemetics to stop vomiting so the patient can retain fluids, broad-spectrum antibiotics to prevent or treat secondary bacterial sepsis, the gut barrier is compromised, nutritional support. Early enteral feeding, when tolerated, improves outcomes. Monitoring, frequent reassessment, blood work, and nursing care. Emerging treatments and research. New approaches, for example, monoclonal antibody therapies, are under study and may show promise, but most community clinics rely on supportive care today. Research ongoing. Prevention, the most important. Vaccination. Parvo is a core vaccine. Puppies need a full series, typically starting at 6 to 8 weeks and repeated every 3 to 4 weeks until approximately 16 weeks per many protocols. Vaccination is the single most effective prevention. Hygiene and isolation. Keep vulnerable puppies away from unknown dogs or shelters and contaminated areas. Parvo can persist in the environment. Disinfect with appropriate agents like bleach solutions when used correctly. Quick action. If an exposed dog develops symptoms, isolate and call the vet immediately. Early intervention improves survival. If a puppy is vomiting and/or has bloody diarrhea, get to a vet immediately. Early supportive care is life-saving. Keep vaccination records up to date and ask about local vaccine clinics if cost is a concern. Many cities run free or low-cost clinics during outbreaks. Don't use homeopathic no-sodes or herbal remedies as the only treatment. Discuss any complementary therapy with your vet. If you found this useful, please like and subscribe. I post weekly pet health guides. If your dog shows any of the symptoms we talked about, call your vet now. I'm Dr. Jonathan. Stay safe and give your pup a hug after washing your hands.